Thank you for choosing Mayo Clinic and the Mayo Clinic Winland Smith Rice Genetic Heart Rhythm Clinic for your care. It certainly was a privilege for my team and me to meet you and care for you and your family. If you were an athlete or are an athlete, you know that during our time together, we spent a significant amount of time talking about several important return to play considerations. This brief 7-minute video has been developed and created to help remind you and your family of the 5 most important items to consider as you decide whether or not to remain an athlete or return to the sports that you love if you had been previously sidelined or disqualified. First, remember the one veto and you are out rule. For both my athletes who are minors and my adult athletes, it is critical that you, the patient athlete, and your family, parents if you are a minor, or the parents and other loved ones if you are an adult, are in complete agreement about your continuation in competitive sport. If one member of the family is against the idea, a family-imposed disqualification remains in place. As we discussed, among those patients and families who come to see me specifically with a primary goal to return to play, about 10 to 20% of them, 10 to 20%, disqualify themselves after their Mayo Clinic evaluation has been completed. The family unit must be in complete agreement. Number 2, as you and your family make this deliberation, remember the 2 O's that we discussed. Is the sport O, so optional, or is it O, so oxygen? If optional, let's skip it. If it's closer to oxygen, let's figure out how and if we can make this work together. Number 3, if you and your family decide thumbs up on a return to play, an RTP, then remember, no covert operations. The appropriate coaches, school officials, trainers, and others must be made aware so that they can help establish your safety plan. Number 4, remember and realize that when you do make them aware, this can and often does take on a life of its own. In other words, while you, your family, and I may be A-OK with your RTP, your school, the league, the institution may not be. Over the past 20 years of my practice so far, our overall batting average for a successful reinstatement on your team has been nearly perfect, nearly 100% for those athletes who are in Little League sports or high school, junior high school sports, or even Division II, Division III collegiate level sports. However, for my Division I university athletes and my professional athletes, our batting average is closer to 50%. In other words, even though we, as the patient-family-physician relationship, have said yes in our shared decision-making model, that SDM model, the university at the Division I university level, or the professional sports, the NBA, NFL, MLB, and so forth, WNBA, any of the professional sports, they have said no half the time. So in this journey of yours, you and your family must realize that at that level of athleticism, those institutions do not necessarily embrace SDM, shared decision making. Instead, they do what I call TDM for their decision making, or BDM for business decision making. If you are at that level, we will certainly continue to advocate on your behalf as strongly as possible. But just remember to proceed with eyes wide open that overall our success rate is around 50%. Number 5, and finally, regarding that safety plan, when you do inform the coaches and school officials and so forth, it's straightforward. You must have an automatic external defibrillator, an AED, as part of your sports safety gear, not relying on some AED residing somewhere in the school building, your AED. Just like an athlete with a potentially life-threatening peanut allergy has his or her EpiPen, or an athlete with a potentially life-threatening asthma has their albuterol inhaler, you must have your equivalent counterattack. As we discussed, if you were to collapse during sport and not regain consciousness within 10 seconds, 911 should be activated, CPR started, and your AED, retrieved by the coach, the trainer, the first responder, whomever, applied, and shock delivered if instructed to do so. But as we discussed, remember, so far in my 20-year career, among the now more than 350 athletes with a variety of sudden death predisposing genetic heart diseases like yours who are under our care, we have never had a single athlete of ours require or receive an AED rescue shock. Importantly, each year when you return for your follow-up evaluation, we will carefully reassess your risk profile. We'll review and further optimize your treatment program if needed, and we will answer all of your questions so that you can remain as fully informed as possible and as comfortable and confident with your decision to continue to stay and play or to stop and move on to something else. Either way, we are here for you and your family. Hopefully this brief review of these 5 return to play considerations have been helpful to you, and we look forward to seeing you again in the near future. Until then, on behalf of Mayo Clinic's Winland Smith Rice Genetic Heart Rhythm Clinic, thanks for trusting Mayo Clinic with your care.